If you have pain with penetrative sex, it can feel like you're the only one dealing with this issue, and that is not the case. It is estimated that 75% of women will experience pain with sex at some point in their life. So, this is a common issue, and despite what you may have been told, it is treatable. I'm a pelvic floor specialist and sexuality counselor, and I treat patients every day that have pain with sex. And I want to talk to you about why it happens and what you can start to do about it today. Pain with sex can happen for different reasons, so it's important to see a healthcare provider to determine what is going on. There could be an infection. There are various medical conditions like endometriosis, adenomyosis, and fibroids that can cause pain. The muscles in and around the pelvis can become impaired. They can be tense, guarded, spasmodic, and that can make penetration painful, and for some people, not even possible. There's also hormonal changes due to life events such as childbirth or menopause, or different medications or health conditions that can impact that tissue in and around the vagina, and that can lead to pain. Basically, the pain you are feeling is real. You are not making it up, and there are providers that can help you. Likely you're here because you want things that you can try to help reduce your pain. First thing I recommend is make sure you devote ample time to foreplay. You need to warm up the area, just like you wouldn't immediately run a marathon. The muscles and the vagina need time to get ready for sex. The vaginal canal is pretty cool because it has the ability to expand and lengthen. This is called vaginal tenting. And this happens with arousal. And for most people, it takes more than a few minutes. The data shows it usually takes around 20 to 30 minutes of foreplay. And a fully aroused vagina can help make sex more comfortable and more pleasurable. I also recommend that you invest in a good quality lubricant. Even if you are lubricated, lube is a great tool that can help enhance the experience. But if you have dryness, which is very common, even if you're wanting to have sex, that can happen. Lube is going to be essential. Slippery Stuff is a great water-based lube, but you really want to find one that's free of parabens, sulfates, fragrances, and flavoring. Next, you want to invest in a good quality lubricant. Even if you feel like you're well lubricated, lube is going to be a great tool that can help enhance the experience. But you especially want to get a good quality lubricant if you're prone to dryness, which is very common. And it can happen even if you are wanting to have sex and you have done a lot of foreplay. Lube is going to still be essential if you have dryness. I really like Slippery Stuff. It's a great water-based lube, but you really want to find something that's free of parabens, sulfates, fragrances, and flavoring. Next, consider some external support. So there is something called the O-nut. This is a great tool that is worn at the base of whatever is being inserted into the vagina. So a penis, a dildo, a strap-on, and it's going to modify depth of penetration, which can help reduce pain. I also am a big fan of vibrators. They can be used externally on the clitoris during penetration or beforehand, and this can help increase blood flow into the pelvis and promote vaginal tenting. But it's also important for people to know that most people with a vagina don't climax from penetration alone and do need clitoral stimulation in order to orgasm. So having a vibrator on hand is a great idea, not only for reducing pain, but also improving pleasure. Remember to breathe. The diaphragm and the pelvic floor move together. So make sure you're breathing deeply into your pelvis because that can help facilitate relaxing the pelvic floor muscles. Don't force anything. Gentle breathing is the way to go. And most importantly, do not hold your breath, as this can impair movement and increase guarding. Finally, make some noise. My friend and colleague, Dr. Britt Van Hees, often says an open throat is an open vagina. So don't be shy, moan, grunt, shout, and you can even laugh. Remember, sex is supposed to be fun. It can be silly. So any noise you can make is a great idea. These tips are not the end all be all. And if you've already tried some of them and they haven't worked, don't worry. There are so many options out there, and as I mentioned, most people do need to work with a specialist to get individualized treatment. So don't give up hope. You are not alone.